Over the last 6 months, we've pulled out all the stops to fight these cuts and their effect on cardiovascular practices and patients. We've clearly had huge media response to ads in the papers, to many, many op-eds, local papers, national papers. Media blitz has gone out to educate people about this. We've begun efforts in the legislature and the Congress to try to get members of Congress to help us reverse these cuts. We've directly lobbied with the Centers for Medicare and Medicaid Services, Secretary Sebelius and her staff at the White House, the President, everybody. We've educated people about how these cuts have unintended consequences and are going to be harmful to patients and cardiology outcomes in the future. The most important thing that can happen right now is for you, the cardiologist, or your patient, or your nurse, to tell your member of Congress personally what that impact and damage is. There's nothing more important or potent than your personal message of harm having been done by this absolutely bad public policy.
Well, the issues of decreased access to care, we serve a very large Medicare population. Not only will they have decreased access because many physicians' offices may have to close, the costs will go up tremendously because the cost to provide these services in a hospital setting is significantly higher than to provide them in an office setting. In addition to that, because of delays in treatment, it's going to result in increased hospitalizations, increased unnecessary invasive procedures, and for the constituents of the state of New Jersey, higher Medicare copays.
Well, the cuts seem disproportionate to cardiologists and to the care that they would deliver. It would hurt my practice mainly in its ability to provide the highest quality of care to the patients in the communities we serve.
Realistically, what I'm looking at is dramatically cutting my office staff and services we provide, like a Coumadin clinic is a nice thing that my patients like, but it loses money, so we will probably close that. The other option would be to become employed by one of the hospitals in Pensacola, and that's not something I would like to do either. I mean, I enjoy being in private practice. It's one of the things I specifically enjoy about being a physician.
The big fear from our side is that there will be a mass exodus from the private practitioners that are going to have to shut down into the hospitals and universities like ours. That would essentially be a denial of care because we're not set up for that sort of volume. And that's really the problem with having such a large cut, particularly in nuclear cardiology, that's not phased in. That phase-in period really allows practices to make plans. Cut some expenses, remove some personnel, it increases unemployment. It's a bad idea all around, but if it has to be, at least it's gradual. Whereas doing something like this all of a sudden doesn't allow any preparation for the system to take those patients. So it essentially is a denial of care.
These CMS cuts are a bit of a distraction from the larger issue of healthcare reform that's taken a lot of our energy. People should realize that ACC is not dragging their feet as far as healthcare reform goes. We're just trying to maintain patient access as it is now and to maintain the kind of gains that we've had over the last decade by reducing cardiovascular morbidity and mortality by 27%.
I think it's very clear that we have to have a bigger, broader fix to healthcare in the United States such that patients who are uninsured end up with an option, whatever that ends up being, and that physicians who are taking care of patients are able to keep their doors open. So even aside from this current legislative fix, I think healthcare reform of some sort is going to be very important.
And regarding advocacy, everybody has to be involved. Sure. And I think the Florida contingency gradually gets the message. Everybody has to be involved. You cannot be working day in and day out and expect the problems to be solved. Exactly. You have to put in your you have to do your part. Mm-hmm. And part of that may be visiting with your local congressman when they come back home. If you don't want to come back to Washington, you have to be gradually involved with the American College of Cardiology Political Action Committee, and you have to do whatever it takes for this problem to go away.
We can't do this alone. The college is there to work for you, and we're going to do everything we can. Every member of the staff, ACC leaders, Fred Beauvais, Ralph Brindis, John Harold, and the Board of Governors, the whole leadership team is out there working on your behalf. But we need you. We need you to go on our website, Look at the sample letters, look at the talking points, look at what others are doing and having success in doing in reaching their members of Congress and getting engaged with their local newspapers. We need you to do all of that for us. But also, we need you to join the pack because we need dollars here in Washington, D.C. to make sure we're at every event defending you and your future and your patient's future. So get involved in the pack, donate to the pack, go on the website, get the tools, and get engaged. And let's get over the finish line together on this battle.